I'm Dr. Joe Kosterich, GP and medical advisor at Little Green Pharma, and today very pleased to be joined by Paul Wong, the CEO of the company. Paul, thanks for your time today. Thank you. We're going to get into a little bit about cultivation and the industry, but first off, Paul, how did you get involved in the cannabis industry?
It's been 8 years now in the industry, and really looking at an emerging industry and the opportunity to be part of an emerging industry and breaking new ground for that industry was really exciting 9 years ago to look at the opportunity. And ultimately, for me, what really drove me to this industry was the ability to not only be part of that emerging industry, but to be part of something that was helping people with a product that had been forbidden for so many years, that we know as a medicine would work, and we know that through history. So to be a part of establishing a landscape where we could not only break new ground, but really be supporting patients that really needed an alternative therapy was super exciting. That really is what drove me.
And we've sort of 8 years down the track, there've been some challenges to overcome.
Oh, of course. Yeah. Look, I think if we go back, we zoom back out to 2017, 16, 18, the challenges we had around just the stigma of the industry was probably the biggest thing at the time, and trying to have a conversation with all stakeholders, but whether it be doctors or politicians or regulators or even patients for that matter, around this as an alternative therapy was our biggest challenge. And I think we sit here today, and whilst we've come a long way, a significant long way, incredible amount in overcoming that stigma, it still exists here today. I mean, you're at the forefront as well as you're. We still see that, and we still have those issues at all levels. And so there's still a lot of work to do for us and for the industry.
So tell us a bit about the partnership with Cannamedical.
Yeah, so it dates back to 2016 or 17. So I think both companies were actually founded in 2016. So we both celebrate our 10-year anniversary in a new emerging industry next year in 2026, which seems pretty amazing actually. And so I think both companies have stood the test of time. It's been a challenging industry, but we met David back at a conference in Europe in I think maybe 2017 or 18, and the relationship really grew from the moment in which we acquired the site in Denmark in mid 2021. We've been delivering some scaled up volumes into the Cannamedical relationship, and we've got this beautiful site sitting there just 2 hours from the border, and it's been really great to work with David and the team at Cannamedical really and grow that relationship since we've really pushed a bit harder into the European market.
That site in Denmark is phenomenal. I've been there. It's massive. Tell us a bit about what you do to look for in terms of cultivation and that process.
We've got a really unique opportunity in Denmark. In some ways, it could be seen as a limitation, but under the Danish Medicines Agency, we're the only country in the world that has a restriction over pesticides. So that, in some ways, really limits our capability on a cultivation front, but it makes us innovate and really find ways to produce a product that is pesticide-free. And ultimately, what that means for our partners and for our patients is a much cleaner product at the end of the day that's really reliable in a medical sense. So that's been a massive advantage. And then the other thing I think we've done as a company there is we've known that we must invest significantly in the phenohunting and genetic profiling and crossing. So we've doubled down on that as a company, and we're starting to see the fruits of that investment now with some really fantastic genetics that are pesticide free, that are really good quality at the right price and really close to that market. And it is a beautiful site. And we're starting, and now we're a few years into that acquisition, but we're really seeing some great product coming out of that site now.
Sounds a bit like that old adage of necessity being the mother of innovation, really, doesn't it?
Yeah, 100%.
You've told us a bit about the origins of the relationship between Little Green Pharma and Cannamedical, and both coming up to a 10-year anniversary, which is just amazing. Tell us a bit about the shared values and ongoing goals of the partnership.
Yeah, look, absolutely. I think, the fundamental goals of Little Green Pharma is about impacting patients. And for us, it's about impacting millions of patients across the globe. And we're on that journey, we're on that pathway. And I think if you jump on and have a look at Cannamedical, it's exactly the same. It's about impacting patients' lives. And I think those simple words and those simple goals are probably what has underpinned the growth of the relationship. If we're constantly getting as both companies and as a partnership, we're thinking about the patient first and what's driving the patient, then I think that sends us in a direction that creates a great partnership. But I think if we take a slightly deeper dive into the values of both organizations, we're pretty simple with our values here at Little Green Pharma. It's all about leadership, imagination, and trust. Trust being one of our absolute core values, and to build a partnership that stands the test of time in a very difficult industry, trust is critical. So for us, that has been something that's been really strong, and we see that in the Cannamedical values. They clearly value good partnerships. They're dedicated towards doing that, and that builds trust in the relationship, which is a key value for us.
Excellent. Paul, thank you for your time today.
Great. Thanks, Joe.